Ready?
Yes, we're recording.
Hi guys, this is our nursing care management group presentation and it's on diabetes. So Mr. FL is a 57-year-old man, divorced, unemployed, who lives with his mother, AL. He has two children, ages 25 and 20, who visit him often. FL also has a few friends who live close by. His friends visit him every other day and provide him transportation to his doctor's appointments and occasional errands. FL currently has Medi-Cal insurance. FL is admitted into the hospital for diabetic retinopathy and vitreous hemorrhage in the left eye. FL has partial vision in his right eye due to diabetic retinopathy a few years ago. Upon assessment, it was revealed that FL does not self-manage his diabetes accordingly. He does not perform daily blood glucose monitoring, follow a diabetic diet, and lives a sedentary lifestyle. Type 2 diabetes mellitus is when there is high levels of glucose in the blood. The body does not produce the hormone insulin, therefore glucose is not able to get into the cell. When there are high levels of blood glucose, many complications can arise, particularly organs that involve small vessels. To control diabetes, treatment includes drug therapy, nutrition therapy, and pancreas transplant. FL was diagnosed in 2010 with type 2 diabetes mellitus. His medical treatment consists of metformin, Humalog, Lantus, and diabetic diet. The nursing diagnosis is disturbed sensory perception related to ruptured blood vessel in the vitreous space of his left eye. The nursing interventions related to his issue are that the staff and family members should consistently provide environmental predictability to FL when his environment is changed and always provide good lighting for him at all times now that his vision is impaired in both eyes. And this is by Yolanda Vasquez. So clinical judgment comparing self-care capacity with chronic illness and treatment demands. FL is a 57-year-old man, FL is experiencing partial vision loss as a result of unmanaged and uncontrolled diabetes affecting his self-care needs. Lupkin and Larson states that self-care capacity is defined as having functional ability to carry out activities independently. Although FL can carry out most ADLs with sufficient lighting, the patient does require a lot of assistance with IADLs. As a result, the patient has limited capacity of self-care and is unable to perform treatment demands of chronic illness safely. These treatment demands include monitoring blood glucose and administering insulin. Without precise vision, insulin administration to self can be fatal and therefore needs assistance from mother and friends with IADLs. Since the patient relies primarily on his mother for help, the patient is at risk for caregiver burden. Lipkin and Larson state that burden is related to the level of care recipient's disability, including behavior and cognitive issues, the extensive care required, and the caregiver's level of worrying of feelings of being overwhelmed. If FL fails to take control of his disease, he not only runs the risk of losing his entire vision, but the use of his lens. If this were to happen, FL would need more assistance with self-care and increase his chances of caregiving burden. By Lorena Ruiz. Priority patient issues for discharge planning. This requires safety, self-care, follow-up exams, diabetes self-management education, and communication. So currently FL has impaired vision in both eyes. Safety is a major concern for him at home. It is important that he is aware of his surroundings and there are no hazards that may cause falling or tripping. FL needs to be reminded and encouraged about the importance of monitoring his blood glucose level every day, at least 3 times a day. It is imperative that he keep his levels within normal range by following a diabetic diet, taking his prescribed medication, and exercising. Following up with an ophthalmologist to discuss further treatment is crucial. It is possible FL may need surgery or laser treatment. Educating FL about his chronic illness and the importance of self-management should be discussed prior to discharge. Since he has not been managing it accordingly, FL should be assessed through therapeutic communication as to why he has not been managing it. If there are any problems preventing him from managing his illness, they should discuss and address it. So clinical judgment about where patient can be discharged. Patient could be discharged at home with family. Education should be assessed with the patient and mother. Teaching should be implemented with the patient and mother. Daughter should be more involved in his care. Educating is a Since Mr. FL requires assistance with IADLs, having a home health nurse can provide thorough social and medical assistance to evaluate the safety of home and health plan. The aim of having a home health nurse is to make sure FL and family are adhering to care to prevent further progression of his debilitating disease. If the home health nurse determines that healthcare needs are not being met, a referral to a skilled nursing facility should be made. A skilled nursing facility will be able to provide services that include daily injections, for example, subcutaneous insulin injections, as well as teaching the diabetic patient about diet, sliding scale insulin, and foot care. Being in a more controlled environment like a skilled nursing facility, Mr. FL will be more equipped to manage his chronic illnesses. Priority nurse care management strategy at the patient level and system level. So patient level of education, you want to management of blood glucose, you want to educate management of blood glucose, medication management, diabetic diet, proper exercise, and at the system level, we want to partnership and communication. So that would be through primary care physician, nutritionist, and home health nurse.
Slide 7, intervention for the patient level nurse management strategy with reference. The nurse case manager should teach Mr. FL to manage his diabetes by getting regular physical activity. Sorry, guys. Eating healthy, checking his blood sugar, and taking his insulin or diabetes pills as prescribed. Keeping his blood sugar levels, blood pressure, and cholesterol levels under control to help prevent or delay vision loss. Keep a log of his blood sugar levels and review them with his health care provider. Get regular eye exams to monitor eye health and be mindful of any changes in vision. If his children live close by, they should be involved in his diabetes, self-management, and education. The nurse case manager should teach the patient to manage his diabetes by getting regular physical activity, eating healthy, checking his blood sugar, and taking his insulin or diabetic pills as prescribed to help prevent or delay vision loss. It is also important to keep his blood sugar levels, blood pressure, and cholesterol levels under control. Keeping a log of his blood sugar levels helps him keep track of his blood sugar levels so he can then review them with his healthcare provider to see how he is controlling his diabetes. Mr. FL should be taught to get regular eye exams to monitor eye health and be mindful of any changes in vision. FL should see his optometrist every 6 months or more often, and he should let the optometrist know if vision changes get worse or if he starts to see double. If his children live close by, they should be involved in the education regarding his self-care so that they can better manage his care for him. Interventions for the system level strategy to reduce the risk or slow the progression of diabetic retinopathy. Patients with diabetic retinopathy should be promptly referred to an ophthalmologist with experience in managing diabetic retinopathy, a dietitian who can help Mr. FL plan meals to optimize his blood glucose control, an endocrinologist who can help the patient to determine ways to improve his diabetes management, a home health nurse can come to his house to help him monitor his blood glucose. A home health aide can also assist this patient with ADLs and IADLs. To reduce the risk or slow progression of the diabetic retinopathy, patients with diabetic retinopathy should be promptly referred to an ophthalmologist, a dietitian, an endocrinologist, Mr. FL should see an ophthalmologist with experience in managing diabetic retinopathy. Some people with diabetic retinopathy Some people with diabetic retinopathy may need a comprehensive dilated eye exam as soon as every 2 to 4 months. If retinopathy is progressing or sight is threatened, then examinations will be required more frequently. A dietitian can also help Mr. FL plan meals to optimize his blood glucose control, and endocrinologists can help the patient to determine ways to improve his diabetes management. The role of the home health nurse is increasingly important as the patients are discharged from the hospital. A home health nurse can come to Mr. FL's house to help him monitor his glucose control. It is also important to set up home health so that a home health aide can come to his house and assist him with ADLs and IADLs.
So utilization review, you want to verify if FL insurance will cover the home health. quality of care issues are addressed, assess other assistance and patient may need, review medical records, ensure managed care if met with program requirements. This is Drew's part. Had to step away momentarily.
Slide 10, quality and safety issues. Make sure FL has proper glucose monitoring device and knows how to properly manage it. Use teach-back method to assess FL from proper glycemic management. Risk for hypoglycemia and hyperglycemia. Educate the signs and symptoms of hypo and hyperglycemia and how to address it. FL may need referrals to an optometrist to follow up with his vision. According to Paul and Tahan, quality review refers to screening the clinical content of the patient's medical record and treatment to determine it professionally and nationally as recognized by standards of care. This is Jupart's part. Nurse case management effectiveness at the patient level. We want to assess Mr. FL's understanding of glucose monitoring and insulin administration use. We also want to assess the areas for change in eating habits and make FL's glucose management family effort. We also want to incorporate exercise into his routine and have Ms. FL have regular follow-ups with his primary care provider for the management of diabetes. The role of the case manager in the case of FL is to improve healthcare outcomes and achieve healthcare goals. It is essential to assess a patient's level of understanding of his current medication regimen to increase adherence to care. Increased adherence to care relies on a patient's knowledge and understanding of the treatment regimen and clear and effective communication between the nurse case manager and the patient. FL's family will participate in the management of care. Studies have shown that positive family involvement can help support a patient's self-care, help manage their diabetes. Areas for change for FL will include incorporating healthier eating habits, a diet consistent and low carbohydrates and fruits and vegetables will help maintain the patient's glucose level stable, preventing further renopathy. Other changes will include cutting back on soft drinks and cooking more meals at home. FL plans to exercise at least 2 times a week. FL will engage in a combination of aerobic and strength exercises. Setting realistic goals of activity will increase FL's adherence to a new workout routine. FL will also FL will also check his glucose before every meal and follow prescribed insulin requirements. FL will track his success in glucose management by follow-up appointments with his primary care physician and monitoring trends in his A1C.
Slide 12, NCM effectiveness at system level. Nurse case management for FL will follow the chronic care model of collaborative care in that a proactive approach is undertaken by the healthcare team to improve outcome. Nurse case management program encourage need intensification of medication regimen for FL. Nurse case management was able to enhance access to intensify care for FL, who is a diabetic patient with poor blood glucose control and has improved blood glucose outcome. FL have been keeping his blood glucose level under control through diet, exercise, and medication. FL constantly check his skin and foot on the daily. He makes sure that he doesn't have any ulcer or sore on his body. He will continue to maintain a healthy weight. He set weight loss goal each month. FL try to do some physical activity each day. Sometimes he will go for a walk, run, or to the gym. FL go to the diabetic support group each month. The support group is great because he gets to meet other people who are diabetic. The support group talks about natural ways people can manage their blood sugar level and complication.